Hi, I'm Dr. Nikki Verrills from the University of Newcastle and the Hunter Medical Research Institute. My broad area of research is in investigating the molecular basis of cancer. So, in studying the genes and the proteins that are altered in cancer cells. And my specific area of research is in leukemia, and more particular in acute myeloid leukemia, or AML. So leukemias are cancers of our blood cells, and AML is a particularly nasty type of leukemia. It's the most common type of leukemia diagnosed in adults. But unfortunately, AML patients have the poorest survival with current therapies. So really my research is aimed at developing better therapies to treat AML patients and to enhance their survival. And so to try and do that, we've been asking the question for a number of years now, what's different between a normal cell and a leukemic cell or a cancer cell? And if we can identify what changes occur in the cancer cell compared to a normal cell, we should be able to specifically target those changes with new drugs, and so specifically kill the cancer cell, hopefully without affecting the normal healthy cells. And so in asking this question, we've identified a number of different changes in the genes and the proteins in leukemia cells compared to normal cells. One of those changes is in a protein called PP2A. And so what PP2A does, it's present in all of our cells in our body, and its normal role in a healthy cell is as a brake to tell cells to stop growing, to stop dividing. And so we class this as a tumour suppressor, because normally it suppresses the growth of cancer by telling cells to stop growing. What we've found in our research is that PP2A is inactivated or turned off in many acute myeloid leukemia patients. So the leukemia cells from these patients have inactivated PP2A, which essentially means the cells have a signal to continue to grow and to continue to divide and hence become a cancer cell. So we've identified that PP2A is inactivated in these cells. The next question then is, well, can we reactivate it? Can we use that knowledge to specifically target the leukemia cells? And so we've been investigating drugs that can reactivate PP2A. And indeed, when we treat cells, at least cells we grow in our laboratory, when we treat leukemia cells with these PP2A activating drugs, we can specifically kill the leukemia cell without affecting normal healthy blood cells. And that's essentially what we want. So the funding from the Cure Cancer Australia Foundation is essentially to move this study to a preclinical trial stage to test if these drugs really can be useful at killing leukemia cells, not affecting healthy normal cells, and ultimately with positive results, hopefully in 3 years' time, we can then move these drugs into clinical trials for AML patients. And obviously that's the ultimate goal of this research, is to improve the survival for AML patients. So we need to move these research findings into clinical trials. And that's essentially what this funding will hopefully enable us to get to. So I'd like to thank the Cure Cancer Australia Foundation for all their hard work, all of those supporters out there raising money so that we can do this important research. And it's important to note that this is new and this is innovative type of research. There's lots of work going on out there looking at drugs that try to inhibit particular proteins. What we're trying to do is reactivate a protein. So it's very exciting, it's very novel. Whether it'll work or not, well, hopefully I'll be able to update you in 3 years' time and let you know positively that it does work, and we can hopefully then lead to better therapies for AML patients. Thanks.